Hello, everybody. I was prepared, and then a family emergency occurred. My notes are now at home, so I am really winging it. I also suffer from white coat syndrome, so you'll have to bear with me if you start to see some palpitations. When Paula was speaking, there were so many notes of familiarity, some of them reflecting the cross communications that we sometimes have in our healthcare system, especially between LHINs. My experience was somewhat different from Paula's. My mother, at the age of 87, was diagnosed with lymphoma, and so began a journey of chemos and radiations and very successful treatments and wonderful nursing and doctors. You know, cannot help but sing the praises of the people that intervened on our behalf. However, when it came to support from our LHIN's CCAC, things were sadly lacking, and sometimes they go from bad to worse. My mother had a subsequent hospitalization, during which, when we were in emergency, we were approached by a representative of CCAC at that time, her role was, of course, to introduce us to the system and let us know what options would be available to us for home care and for support following discharge. I informed her promptly that we had a community care worker, that we were in the system, and that we had every intention of contacting that individual upon discharge. That's fine. Next day, we're admitted. We have another CCAC person come to us on the floor. Wanted to introduce herself, let us know what services were available to us upon discharge. I promptly informed her that, thank you very much, but we do have a community care worker who we will be talking with. Okay, day 3. Another CCAC person comes to introduce herself to us to tell us what resources are available to us. Our other one had taken a few days off, so she wanted to make sure we were well versed. I then again explained to her our situation, and what came to me is how many people are sitting in beds like Paula was, where our redundancy was taking away from her ability to get the help that she needed. It seems to me that there should be a very simple way that when we were first admitted through Emerge, that it would be noted on the computer system that we were already clients in the system, and that our community care worker should have been contacting us on discharge to see if our help was adequate. The other thing I wanted to address briefly was the lack of consistency in caregivers and the number of assessments that my mother and my stepfather, who is a 93-year-old blind veteran with AFib, my mother, as a consequence of her chemo, suffered from dementia. We were assessed at least 16 times over a period of 8 years by 8 different care coordinators. Okay? These are stressful events for my parents, and I have to say, in reality, we're not on an upward trajectory. What do they possibly think is going to improve? And I keep thinking again, could not just a simple phone call check in with your clients, make sure they're getting the care they need. Then, use your other coordinators to take care of the other people in the system. Don't waste money with visits, travel time, everything. I just feel that with the technology available to us, there is money in the system. It's maybe not enough, and certainly won't be enough in the future, but it is enough that right now, with proper technology, we could use our money more wisely and more compassionately. And I think that's, really what I wanted to address this evening. And thank you for bearing with me without my notes. So thank you very much.